I'm going to palpate your frontal sinuses and these ones here as well. Everything looks good, your skin looks good. Overall, your skin looks good and intact. It has a good warm temperature to it, so that's good. Okay, I'm going to start off by doing 2 tests. So the first one is a sharp and dull test. So this is what sharp feels like, and this is what dull feels like. So I'm going to do this on your face, and you tell me where you feel it, and if it's sharp or dull. Okay, can you close your eyes for me? Sharp. Dull. Sharp. Sharp. Perfect. Dull. Perfect. And now we'll do the same thing with the little convex. Perfect. Okay. Perfect. So your face looks good. It's symmetrical. The color looks good. Your facial nerves are working. Everything's good. Next, we are going to move to the eyes. So I'm going to start off by assessing your optic nerve. So I'm just going to give you something to cover your eyes, and then you'll tell me when you see my fingers in your peripheral vision. And then once we get to this station, I will also be testing your red reflex with the little with this thing. Yep. And so that will also be testing your optic. Okay. So here you go. Can you cover your eyes? Okay. Now tell me when you see my fingers. See it. Perfect. I see it. Perfect. Okay, I have a few more tests for your eye. I'm also going to just assess your overall appearance of your eyes, your lacrimal ducts, your sclera, your pupils. Everything looks good externally. I am now going to assess your ocular motor. So I'm just going to shine a light and see how your pupils contract. And I'm also going to just look at your corneal light from this side. Can you follow this pen with your eyes? Perfect, good accommodation. Now I'm also going to have you, I'm going to test your abducens and your trochlear. So just follow this pen with your eyes. I'm going to be going in various shapes. Perfect. I'm also going to be testing your trigeminal nerve. So it's called, this will be the corneal reflex. Okay, you blink, so that's good. Good. Okay, do you want to come down to the station so you can check your red light reflex, which is also part of the optic exam. Okay. Are you comfortable? Okay. I'm going to have you look straight at me. Okay. Perfect. Now that we're here, I'm also going to just inspect your ears. I'm going to inspect them. I'm going to see if there's any tenderness. Is there any pain? No? Okay, perfect. I'm just going to look inside your tympanic membrane using the otoscope. Okay. Pull your ear up and back. Look. Looks gray, shiny, translucent. Looks good. Okay, and come back, have a seat. So I've assessed your head, I've assessed your eyes, I've assessed your face and your ears. Next we will be assessing your olfactory. So I'm going to give you 2 items. You're going to plug one nose and you're going to let me know what you think it is. Okay? Okay. Can you plug one nose? Yes. Peppermint. Perfect. Cinnamon. Perfect. And also in combination with your ear, I also have 3 more exams that I need to do. The first one is whisper. So I'm going to whisper something in your ear. You're going to close off one ear, and you're going to let me know what you think I said.
Okay.
Hello. Perfect.
Julie.
Perfect. Now I'm going to be performing the Weber test, so I'm just going to ring this, and you'll let me know if you feel it vibrating on both sides.
Yes.
Okay, perfect. Now I will be performing the Rhine test. I'm just going to place it behind your ear. You let me know when you stop hearing the vibration, and I'll place it right next to your ear. And let me know when you stop hearing that sound as well.
Okay. Stop. Stop.
Perfect. Let's do this here.
Stop. Stop.
Perfect. Okay. So we've assessed your head, your face, your eyes, your nose. We've completed your ear exam. Everything seems to be good. The next exam that we will be doing is just a quick swallow test as well. And I'll have you swallow for me. This will test the vagus nerve. Perfect. As well as the hypoglossal. And I will also give you two things to try. You will let me know what you think they are, okay? Okay. So there's that side.
Sugar.
Yes.
Salt.
Perfect. Would you like another sip of water?
No, I'm good.
Okay, perfect. So, your everything seems to be good. You've swallowed wonderfully, that's good. So next I'm going to be moving down to your neck. So I'm just gonna first start off by palpating the trachea. Okay, no tenderness, it's midline. And I'm also gonna be taking a look at your thyroid glands, both sides, no tenderness, no pain. I'm also going to be assessing for JVD, so if you could just look that way. Perfect, no JVD. That way, no JVD. I'm going to be feeling your carotid pulses. Okay. Perfect, fully bilateral. And I'm also going to check your accessory muscles, so I'll have you push up against my hands. Perfect. And can you move your neck, go back, side to side, and down. Perfect. So everything looks good. Your trachea is midline, your no JVD present. I've checked your carotid pulses. They're bilateral. I've also checked for fluids. Everything is good. I've checked your accessory muscles, good shoulder shrug. Everything looks really good. And I will be performing the next test, which I will be listening to your, I'll be assessing your chest.
Okay.
So, you doing all right? Okay, thank you so much for being cooperative. So, I'm going to first just take a look at your chest. It's symmetrical, it's equal, everything looks good. I don't see any bruises or lesions or anything. I'm going to now just palpate. Okay, and I'm also going to palpate for your lymph nodes. So I'll start with the occipital and with the post, auricle, the preauricle, the parotid, the submandibular, submental, the posterior cervical, and the anterior cervical, also the super deep cervical, and the supraclavicular. So all of those look good. I don't feel anything. And, oh, you're getting cold. Okay, so let's continue with your chest. I've assessed it. I've palpated it. Next, I'm going to percuss. So I'm just going to percuss in all of the lung regions. Okay. Can you lift your we'll get to the back in a bit, but I will also check for chest excursion. So I'm going to have you breathe in. Perfect. Breathe in. Okay. And now I'm also going to, while I was palpating, I didn't feel any crepitus or anything like that. Everything seems normal. Now I want to check for tactile firmitis. So I'm just going to have you say 99. I'm just going to palpate with my hands, okay? Okay, can you say 99?
99, 99, 99, 99, 99, 99.
Okay, perfect. Now I'm going to go and percuss the back. Okay, and I'm also going to check for your diaphragmatic excursion. So I'm going to use tape to do that. I will do each side.
Okay.
Let me get my tape ready.
Okay.
Take a deep breath in. Keep it in. Breathe out. Okay, can you take another breath in? Okay. I'll do this side. And breathe out. And breathe in. Okay, breathe out. Okay, take a deep breath in. Okay. Breathe out. And I'm just going to measure that on the left side. It's about 3 centimeters. The right side. 3 centimeters as well. So that's good. 3 to 5 is normal. And I'm also going to have you say 99 so I can check for tactile firmitis as well in the back. So whenever you're ready.
99, 99, 99, 99, 99, 99.
Perfect.
Edema, and I want to go ahead and palpate and feel. So I'm feeling brain edema, any masses or lumps underneath the skin, and I'm also feeling that she does have a warm temperature, but the skin is dry, which is appropriate. So after doing that, I'm going to go ahead and find her sternal border, so that way I can go ahead and listen in the 5 spots and get the 5 different sounds. So after locating the sternal border, I know where I'm going to be starting to go ahead and listen in those 5 different areas, starting with the aortic area. And the aortic area usually falls at about the 2nd intercostal space. So I'm going to start with, because the aortic is on the right side of the sternum. From there, I'm going to move directly to the left side of the sternum and feel for the pulmonic area. From there, I'm going to move down 1 intercostal space to listen to Erb's point. And as I'm doing this, I'm listening to the S1 and S2 sounds, which are lub-dub, and they are even throughout, and they do have a regular pattern. But after Erb's point, I'm going to move down 2 intercostal spaces to the 5th space and listen to the tricuspid area. And the sound is clear, and then from there, I want to move directly to the lateral side to listen to the mitral area. Is it okay if I go under your shirt?
Yeah.
Again, the pattern is even, and it is clear throughout with the lub-dub sounds being even, S1 and S2. And then I want to go ahead and just take her heart rate. And I'm going to take it over in the pulmonic area. So after doing that, her heart rate would be 78 beats per minute, which is an appropriate heart rate because you would want the heart rate to be between 60 to 100 beats per minute. So it is within an appropriate range. So after doing that, what I want to go ahead and do after inspecting, palpating, and auscultating in all these spots, I'm going to go ahead and look at her upper extremities. And looking at them, there are no lumps or lesions to them. There appears to be no bruising, and there appears to be no edema. The skin is pink undertones, which again is proper for ethnicity. So if I'm looking at the arms, they appear to be good, and I'm going to go ahead and feel them and feel for any swelling, lumps, or bruises. And the temperature is warm and dry to the touch. And I also want to go ahead and feel her brachial pulses on each side, and I'm going to go ahead and rate them. I would say that it's about a 1 on the right side. And I would say 1 on the left as well. And then I'm going to move down to her radial pulses. And I would grade both of those to be a 2. So then after doing that, I'm going to move back up to her neck, and I'm going to go ahead and feel for her carotid arteries. And in doing this, I want to make sure that I'm only feeling one at a time so as not to break off the circulation of blood flow to her brain, which could potentially cause her to pass out. Her carotid on the right side is a strong pulse, and I would grade it a 2. And I would grade the other side to be a 2 as well. After doing that, I'm going to go ahead and listen to her carotid arteries to listen for any bruise, and I'm going to listen in 3 spots. I'm going to listen at the top, up near the jawline, midline, and then down near the base of the neck. And as I'm doing this, I'm going to be listening with the bell of my stethoscope to be able to hear clearly. So before I go ahead and place this, what I'll have you do is I'm going to have you take a deep breath in and a deep breath out. And after letting your breath out, I want you to go ahead and hold your breath as I listen to 3 different spots on your neck. So go ahead and take a deep breath in and deep breath out, and go ahead and hold it for me. And then go ahead and let that breath out. And then we're going to go ahead and repeat the same thing on the other side. Go ahead and take a deep breath in and out, and go ahead and hold that for me. Alright, so there was no sound of bruise in her carotid arteries, which is a good sign, which is what we want to see. Next, I want to check for her jugular vein distension. So if I can have you go ahead and lay down for me. And in doing this, I'm looking at her jugular vein to see if it is filling up, which is not, but I want to make sure that I'm checking on both sides. So it's not filling on the right, and it is not filling on the left either. So that means that I do not have to further assess this. So you can go ahead and sit back up for me. Next, what I want to do, because I've already looked at the upper extremities, is I want to look at the lower extremities, again inspecting the color of them and hair distribution. And hair is evenly distributed, the skin is pale with pink undertones, and there appears to be no lesions or bumps to them or any abnormal shaping. And then I'm going to go ahead and feel them for any edema or warmth touch in any areas, and also for any lumps or masses that could be underneath the skin. Doing this, I can't feel anything, and the legs are warm and dry to touch, which is appropriate. Next, what I want to do is take her posterior tibial artery on both sides. So I'm going to start with the right side, and so I'm going to find this over near her ankle. So I'm going to find this right here, and I'll go ahead and take her posterior tibial pulse. And I would grade that at about a 2. And then I also want to feel her dorsal pediis pulse, which I'm going to lay my hand over the top of the foot to see where the pulse is radiating from. rate that at about a 2 as well. And then I want to go ahead and repeat the same thing to the other side, doing the left side's tibial pulse. I would grade it a 2 on the left side. Then again, I'm going to feel for the dorsal medius. Which again, I would grade that to be a 2. While I'm down here, I also want to check for her capillary refill. So what I'm going to do is I'm going to feel the middle 3 toes and check for the capillary refill to make sure it refills within the 3-second period. Capillary refill is good on the right foot, as in it fills within 3 seconds. And on the left foot, it fills within 3 seconds as well. And I want to make sure that I'm doing this on the hands. So if I can go ahead and see your hands, I'm going to do this from the middle 3 because the ulnar artery and the radial are what supply the hand with blood. So I want to make sure as I'm feeling it from the middle to make sure that it's being supplied 100%. There, capillary refills good on the right hand. It fills within 3 seconds. Same with on the right. And then this concludes my cardiac assessment.
Table like this, and I'm going to have you bend it as much as you can. Okay, and in that same position, this way. Perfect. Okay, I'm going to have you put your hand flat on the table and bring it towards your pinky as much as you can. Okay, and then in a straight position and bring it towards your thumb. Okay, you can relax. Alrighty, so now I'm going to measure the joints of your fingers. So I'm going to have you put your forearm on the table and kind of make a flat fist. Excellent. Just hold it there. Okay. Okay, and now I'm going to have you bend these joints right here. Good job. Okay, and now I'm going to measure these smaller joints right here. I'm going to have you flip your hand over, and I'm going to put the goniometer here, and I want you to touch it and slide your finger down. Good. Good. Okay. Good job. Alrighty, now go ahead and flip your hand over, and I want you to bring your thumb out as far as you can to the side. Good. Ready? And then on your side, and then make an L shape. Good. Good job. Okay. And then again on your side, can you bend this part of your thumb for me? Okay. And then up and bend that as well. Good job. And lastly, I'm going to have you touch every finger to your thumb. Good. Hold it there. Don't let me move it. Good. And now bring it up and a little bit towards your thumb. Good. Hold it there. Don't let me move it. Good. Now go ahead and put your hand on the table and bring it up and a little bit towards your pinky. And I'm going to apply resistance at your 5th finger. Good. Okay, and then bring it up and towards your thumb. I'm going to apply resistance at your 2nd finger. Hold it there. Don't let me move it. Good. And now you can do that same position and then lean forward just a little bit and bring it up and a little bit towards your thumb. And I'm gonna apply to your second and third finger. Hold it there, don't let me move it. Good. Alrighty. So I'm gonna hold your fingers here. Can you go ahead and bend that finger up? Good. Hold it there, don't let me move it. Good. Bend this up. Hold it there, don't let me move it. Go ahead and bend it. Hold it there, don't let me move it. And lastly, up. Hold it there, don't let me move it. Okay? Now I'm going to stabilize your hand here. Go ahead and bring this part of your finger up. Hold it there, don't let me move it. Good. And up. Hold it there, don't let me move it. Good. Hold it, or go ahead and bring it up. Hold it there, don't let me move it. Good, last one. Go ahead and bring it up. Hold it there, don't let me move it. Good. Okay, now I'm gonna go ahead and have you bring your hand up, kind of like in the shape of a duck. There you go. I'm gonna stabilize here at your proximal crease. I'm gonna have you hold it there and don't let me move it, okay? Good. Hold it there, don't let me move it. Good. And last one. Good. Awesome. Okay, now I'm gonna have you bring your hand up, kind of you're gonna bend these joints back. Good. I'm gonna stabilize here. Hold it there, don't let me move it. Good. Hold it there, don't let me move it. Hold it there, don't let me move it. And last one, hold it there, don't let me move it. Good job. Okay, now I'm gonna have you make the longhorn sign. Good. Hold it there, don't let me move it. Good. Hold it there, don't let me move it. Good job. Okay, now can you lay your hand flat on the table for me? And I'm gonna have you spread your fingers apart as far as you can. And I'm gonna try and push your fingers in, and I want you to hold it there and not let me move it, okay? Good. Hold it there, don't let me move it. Good. Hold it there, don't let me move it. Last one, hold it there, don't let me move it. Good. Okay. And then kind of bring your hand up like this, and I'm gonna have you put your fingers together. Good. Hold it there, don't let me move it. Good. Hold it there, don't let me move it. Good, and last one, hold it there, don't let me move it. Good job. You can go ahead and put your hand flat on the table with the back of your hand, and you're gonna bend up your pinky as much as you can. Good, hold it there, don't let me move it. Good. Okay, go ahead and make that longhorn sign again for me. Hold it there, don't let me move it. Good. Okay, and then we're gonna have you put your hand on the table and spread it out as far as you can, and hold it there and don't let me push your pinky in. Good. Okay, now I'm gonna have you put your pinky and your thumb together. Good. Hold it there, don't let me move it. Good. And do your thumb as well. Hold it there, don't let me move it. Good job. Alrighty, so go ahead and put your hand on your side, and I want you to bend this part of your thumb. Good. Hold it there, don't let me move it. Good. Go ahead and bend this part of your thumb. Hold it there, don't let me move it. Good. Okay, now go ahead and do a thumbs up for me. Good. Apply resistance here. Hold it there, don't let me move it. Good. And hold it there, don't let me move it. Good. Okay. Now I'm gonna have you put your hand up like this, and I want you to keep your thumb in as much as you can. Good. I'm gonna stabilize at your second finger. Hold it there, don't let me move it. Now go ahead and put your hand flat on the table and bring your thumb out as much as you can. I'm gonna stabilize here at your wrist, and I'm gonna apply pressure here. Hold it there, don't let me move it. Good. Now go ahead and put your hand on your side and bring it out into that L shape. I'm gonna stabilize at your wrist. Hold it there, don't let me move it. I'm gonna grab your hand for you here. Can you turn over? Good. And bring your wrist up as much as you can. And a little bit towards your pinky. Good. Hold it there, don't let me move it. Good. And a little bit towards your thumb. Hold it there, don't let me move it. Good. I'm gonna set it down for you. Okay, I'm gonna take it here. Bring it up. Can you bend it up as much as you can? Good. And a little bit towards your pinky. Good. Hold it there, don't let me move it. Good. And a little bit towards your thumb. Good. Hold it there, don't let me move it. Good. And then can you bend forward just a little bit? Good. Hold it there, don't let me move it.